Hello everybody, I'm Barbara Stead-Coyle, CEO with Muscular Dystrophy Canada, and it is my pleasure to spend a few minutes with you talking about the impact that Muscular Dystrophy Canada has had in the past year. Each and every day, those of us who work at Muscular Dystrophy Canada are inspired by the people we meet and the stories we hear. Stories of commitment, courage, determination, and caring. Stories that encourage us and ignite our passion to work harder, ensuring we can deliver on the promise to our neuromuscular community. Stories of people who are fueled by hope for a cure and for empowering the lives of others. Stories of clients who push past the obstacles and pain to thrive and inspire others. Volunteers who won't stop until their hope of a cure is a reality. Firefighters who dedicate themselves to fighting alongside clients, and donors whose passion for change ignites us all. By bringing people together who share a common cause, we create a passionate and caring community rooted in the desire to support and help each other and bring a future that is free from neuromuscular disorders. At Muscular Dystrophy Canada, we are more than an organization serving clients. We are a family, and we are strongest when we work together. More than 50,000 Canadians are impacted by neuromuscular disorders. They are mothers, fathers, brothers, sisters, sons and daughters, co-workers, and friends. The reality is this disorder can strike at any time, and in fact, many are diagnosed well into adulthood. Each and every person is impacted by a neuromuscular disorder in an individual way. No journey is the same. Neuromuscular disorders do not discriminate. All they really care about is robbing you of muscle strength, making it hard to walk, run, play, talk, eat, and remain independent. They may progress very quickly or very slowly. The simple reality is, currently, there is no cure. Muscular Dystrophy Canada was founded in 1954 because there was nowhere to turn to for help and support, for information, and for the relentless search for a cure. The people to sign on and champion this cause first were the firefighters. The movement started in Toronto and soon spread like fire across Canada. They are the fuel that ignited a movement, and they have been by our sides ever since. In their words, until there's a cure, there's us. Since those early days, Muscular Dystrophy Canada has become a diverse family of volunteers and donors, including clients, family members, community supporters, like-minded organizations, healthcare professionals, researchers, and of course, firefighters. We respect our history and grassroots connection while we raise up to the new challenges we face. Challenges that forced us to find new and creative ways to support our clients, ensuring the greatest reach and impact, all the while remembering we are here to be of service to others. It is this impact that inspired and in fact required Muscular Dystrophy Canada to undertake a strategic planning process and build a pathway that would bring change to our organization, providing more money to fuel our mission and allowing us to grow along those we served, meeting their needs as their stories changed. Pushing beyond possible is that roadmap. It is a path built with and for our community. The message, we need to reach higher and push harder. This past year marked year one of our strategic plan. And what a year it's been. Together, and because of the commitment of all of you that are part of the Muscular Dystrophy Canada family, we raised more than $9.6 million. Even more exciting is that we've also significantly lowered our fundraising and administration costs. As part of our strategic plan, we set a goal of hitting the Canada Revenue Agency guideline of 35 cents in 3 years. We did it in less than one. Why is that important? It means more of your dollars are invested in what matters to you most, our mission, specifically research, programs and services, and advocacy. And the money came from many sources: chapters, walks, direct mail, rooftop campouts, stair climbs, truck pulls, the list goes on and on. It comes in $10 and $20 at a time, and we are grateful to every Canadian who brings our mission to life. Beyond that, we built more partnerships, leveraged more research money, invested more in mission, registered more clients. Simply put, we had more impact. A bit of a deeper dive into the numbers shows us that more than 35,000 donors and some 800 volunteers nationwide made all of this happen. 611 fire departments participated in raising funds and awareness. To date, firefighters have raised in excess of $88 million to support our clients and families. Walks raised more than $1.4 million last year and served as a safe and welcoming haven for newly diagnosed families, where they found support, a community, and hope. We are truly grateful to everyone who supports Muscular Dystrophy Canada in their own way. So how did we actually spend this money? Our equipment program continues to fill a very important need in our community. Wheelchairs, assistive devices, hospital beds, lifts, and so much more. Equipment that helps lighten the burden for caregivers and provides independence for those living with the disorder. Research comes next, and the development of new treatments and clinical trials is happening faster and faster. Our programs and services play a critical role in informing and supporting members of the neuromuscular community. Our advocacy efforts focused on enhancing public policy at all levels of government to bring about positive change. A closer look at some of our results. 231 people participated in our caregiver and family retreats, and we continue to expand this important program nationwide. We invested $1.2 million with our partners and leveraged $4.9 million to provide 813 pieces of essential equipment. We invested in 7 research grants and responded to more than 11,000 inquiries for support. All in all, we were very busy. Funding cutting-edge research has always been a priority for Muscular Dystrophy Canada, and this research continues to be absolutely essential to our charitable mission. We focus on supporting research that seeks to uncover new treatments and therapies and enhance the quality of life while ultimately finding a cure. Last year, we invested more than $900,000 in research, both in Canada through our ever-growing seed grant program and internationally through our partnership with the Canadian Institute for Health Research. We partnered with the Starrett Family Foundation and industry to host the Canadian Neuromuscular Disease Network Summit, bringing together Canada's leading researchers and clinicians to accelerate the research portfolio. And we continue to seek new opportunities. In fact, in January, we will welcome Dr. Daria Vortal to our team as the Director of Research. Daria comes to us from Sick Kids Hospital and the University of Toronto, where she worked with Dr. Ronald Cohen and his lab on the well-known CRISPR project for Duchenne. Daria will be building out our research investments and ensuring that our community has information on all things neuromuscular. We built community connections through conferences, chapters, networks, meetings, presentations, educational sessions, and community activities, where we offer clients the opportunity to build a community of support. We empower clients and family members, caregivers to connect with individuals living similar experiences, finding peer support. This allows our clients to build the social networks they need and determine priorities and topics that are of importance to them. Adjusting to life with a neuromuscular disorder can be overwhelming. There is so much to know and learn about building a new life with a complex disorder. And to make things even more complicated, no two people experience the disorder in the same way. A custom approach is needed each and every time. That's where the Personal Empowerment Program comes in. Our personal empowerment specialists work hand in hand with clients and family members as they navigate their diagnosis and find a way to live with their disorder. They provide information on treatments and trials and navigate complex healthcare systems. They assist with equipment funding applications and help clients connect with networks and support systems. Most importantly, our specialists provide emotional support, encouragement, and mentorship to enhance life skills, self-esteem, and coping strategies so clients can thrive. In the words of one of those we've served, "My neuromuscular disorder doesn't define me. I have goals and dreams to fulfill. I need help though, not just a referral, but a helping hand along my journey." As the voice of the neuromuscular community, we continue to advocate to government and decision makers for policy changes that will better the lives of our clients. We are currently focusing our advocacy efforts on access to trials, new treatments, and affordable medications, both at the federal and provincial levels. This is a new activity for Muscular Dystrophy Canada, as never before has there been a time when so many treatments and trials are available to our community. We are honored that government, industry, and policymakers consider Muscular Dystrophy Canada to be an independent, reliable, and credible source of information and advice on behalf of our community. We continue to look to how we can ensure we have a voice in these important conversations. Staff and volunteers also work with clients and their family members to provide guidance, coaching, and resources to ensure they feel confident in advocating for themselves and their loved ones at a local level. In the very powerful words of one of our clients, Richard, he says, "I don't ever sugarcoat what's happening to me. I understand what having a terminal illness means, but that doesn't ever stop me." And these words are demonstrated each and every day in our lives at Muscular Dystrophy Canada. So finally, the question is, why get involved? This has always been the easiest question for us to answer. Our hope is to ensure every single Canadian who is living with a neuromuscular disorder has the tools and resources they need. We hope you continue to be part of this journey with us. It all comes back to our community and being able to provide those affected by neuromuscular disorders with programs, services, and support that they need to live full and rich lives. It is about a passion for caring and giving, and the hope for a day when our work is finally done. It is this sense of community that connects us to each other and makes our lives so rich. In the words of Helen Keller, "Alone we can do so little. Together we can do so much." Thank you.